Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then this subdural hematoma types. Subdural hematoma can be divided into two types. We have acute subdural hematoma and chronic subdural hematoma. First, what is acute subdural hematoma? In acute subdural hematoma, the patient will present with a unilateral headache first, and there is first the patient presents with unilateral headache, and slightly enlarged pupil is seen, mainly on the side of the hematoma is seen, and the patient will also have stupor or coma can be there with hemiparesis, or there can be unilateral pupillary enlargement may be seen. Okay, why is there unilateral pupillary enlargement? See, when there is subdural hematoma, okay, so this is the two hemispheres. When there is a bleeding, venous bleeding is seen here. Okay, this will be compressing this side of the brain. So because of this compression, it causes hemiparesis, and it also compresses the third nerve. When third nerve is paralyzed, third nerve is responsible for the meiotic action. Now because of compression, the third nerve is paralyzed, and thus it results in unilateral pupillary enlargement. Then we have chronic subdural hematoma. So in chronic subdural hematoma, right, in chronic subdural hematoma, the patient presents with progressive hemiparesis, or the patient may present with aphasia because of increased blood accumulation in the brain between the dura mater and subarachnoid matter. This will result in raised intracranial pressure of the patient, which will present as intracranial pressure features, like there can be papilledema is also seen. Okay, next, here in chronic subdural hematoma, there the patient will have a mild head injury. After sustaining a mild head injury, after weeks of sustaining mild head injury, it develops in elderly patient. If an elderly patient is sustained, so in elderly patient, if the patient has sustained a mild head injury, then after weeks of that, the patient will develop subdural hematoma. A mild injury in elderly patient, after that within weeks the patient develops subdural hematoma, because here there is gradual accumulation of blood is seen in the subdural space, that is between the uh, dura mater and the arachnoid matter, and thus the patient will mostly present 3 weeks after initial bleed. So that is the reason why we call it as chronic.
thank you and thank you for watching.